My name is Layla. I'm going to be your nurse today. Alright, so I'll go ahead and first pull a curtain, make sure we have some privacy. I just did my hand hygiene. Alright, I'm going to go ahead and check baby's wristband and mom's. Alright, little one, I'm going to go ahead and check your wristband. Alright, it does match mom's wristband, okay? Perfect. So then before baby starts to cry or anything, I'm going to go ahead and listen first. I'm going to undo baby, going to fix up this swaddle. I'm going to undo baby's shirt. I'll go ahead and do my vitals real quick. And listen while I'm up here. I will go ahead and listen to respiratory and count. Put my hand on the abdomen. All right, baby's respiratory sounds or lung sounds are clear. Awesome, they sound amazing. Respirations. Baby is breathing at 40. Normal for baby is 30 to 60. Then also I'll go ahead and do my heart rate. I'll go ahead and listen to the right here, listen to the heart sounds and also count. Listen to some heart sounds first. Go right back down here and I'll start counting. Baby is at 120, so that's between the 100 and 160, so that's perfect. All right, and I'll also go ahead and do the temperature. Beep, 98.6, that's perfect. That's right in between that 97.7, 99.5 range. And also, I'll go ahead and do some bowel sounds as well. I'm already listening. Bowel sounds are great, active. Those are awesome. Okay, I'll do my stethoscope, the baby's vital signs and all that. So I'll go ahead and cover baby back up, just so baby stays warm. All right, then I'll go ahead and do baby's head. I'll do molding, sutures, and fontanelles. So baby's molding is looking great. Baby's head is not too cone shaped, and it's just that perfect round shape for baby. A cone shaping can happen from the birthing canal, but baby's molding looks good. I'll go ahead and feel the fontanelles. I'll do the posterior and the anterior fontanelles. We want those soft and hard, soft and flat. I'll feel those. They're both soft and flat. And then I will go ahead and do assess the sutures. If the suture lines are crossing, that's okay. That's normal. They can cross. It's just a part of the molding process. Baby's sutures they're just meeting up. They're not quite overlapping yet. And there's no huge spacing between suture lines. That would not be good. That'd be an abnormal finding. Baby's sutures are looking good. They're touching. They're not overlapping yet. All right, baby's head looks good. I could also assess for a cephalhematoma. That's a collection of blood under baby's skin. That'll be in one area that we generalize. It'll be in that one area. It does not cross sutures. It is a collection of blood, so we'd be on to assess for that. And we also want to assess for caput succedatum, the generalized swelling all over the baby's head, and that's fluid and not blood, so it'll be all over, and that one does cross sutures. Baby does not have a caput succedatum or a cephalhematoma, any of those. Baby's head is normal and intact right now. Everything's good. I'll go ahead, since I'm right here, I'll move down to baby's eyes. Baby's eyes, the sclera is white. I do not see any unusual discharge coming from the eyes. I don't see any blood or any redness of the eyes that could indicate bleeding. That would not be good. I don't see any of that though. Baby's eyes look good. And baby's eyes are white and they're not yellow, which could indicate jaundice. I also do not see an epicanthal fold, and I don't see, like I said, discharge, any signs of conjunctivitis, anything like that. I could also assess the baby's eye placement, and then the eyes bilaterally, just compare them and make sure they're equal. Baby's eyes match up with the top of the ear. That is a normal finding. I'll do that on both sides. That is what we want to see. Now do the 1/3 assessment. I'll take my finger, measure one eye, in between, next eye. Baby's eyes are both equal. All right. And then since I'm right here, I'll do the ear assessment. I'll do the recoil, bend the ears. They should bounce right back. Baby's ear recoil is great. Alrighty, and then I can move on down to the nasal passageways. I'll occlude one side of the nose, and then I will let baby breathe through the right side. Do it for both sides. Make sure each nair is getting airflow, and make sure it's adequate and bilateral. Make sure both sides are getting the same amount. And I don't hear any obstructions or anything. Okay, baby's nares are perfect. They're working great. And then also I'm looking at her respiratory. While I had her uncovered, while I was listening, while I was looking at her nose and everything, I did not see any signs of respiratory distress, which are seesaw breathing. I did not see any nasal flaring. I did not see any retractions. I did not see any grunting or hear grunting. And I did not hear or listen to apnea greater than 20 seconds. So baby does not have any signs of respiratory distress. And I already checked one sign of jaundice. And the second one is the forehead. I checked that right now since baby's head is right here. No signs yet. I'll check also baby's neck and head range of motion, and I will check the clavicle right now. So I'll palpate front and back. There is no, I don't feel any any nodules or anything at baby's neck, anything unusual or any enlarged lymph nodes or anything. I will check baby's clavicle. It could break during in the birth canal if the baby's too big. I do not feel a broken clavicle. Baby's head range of motion is great. Baby's like scrubbing around right now. Head range of motion is good. So now I will move on down and do my body assessment on baby. So I'll do this as fast as I can just so the baby does not get too cold, okay? And right now, since I got baby uncovered, skin looks great for ethnicity. Baby does not feel cold or anything. Baby feels awesome. So skin color is normal for ethnicity. I can assess for jaundice right now within the eyes, with the forehead, that's my 2. I'll press down chest, abdomen, and thigh. And while I'm at the thigh, I can also pinch for skin turgor. So I did baby's skin. Her skin looks, his skin looks great. Her skin looks great. And so I will go ahead and start from up here and work my way down. So I'll pop a baby's abdomen. Baby's abdomen is great, soft, doesn't have any nodules. It's round, just like we want it for baby. And then I looked at baby's respirations earlier, assessed for any distress. I can also do baby's umbilical cord right now since I have exposed. There should be a clamp on baby's umbilical cord for hospital policy and rules. Clamp is there. Baby's umbilical cord is not too dry, but it's also not overly moist. It's perfect. A little moist. There's no unusual drainage or anything coming from it. There's no current bleeding or anything. Baby's umbilical cord is intact. So I could just go ahead and close Miss Baby back up. And then I could, since I did not do the mouth yet, I could just go ahead and do the mouth. I will go do my hand hygiene, put gloves on, and I could go in the mouth. I will stick my second finger in the mouth. I would feel a soft and hard palate, make sure those are closed. Check for any spacing or anything like that. Just check those hard and soft palates. I would stick my finger in the mouth, just make sure there's nothing unusual going on. Make sure there's no bumps or anything inside the mouth. I don't see any of that. And then I could go ahead and slide my finger down, check a gag, and I could also assess baby's sucking reflex. Baby should be sucking on my gloved finger. I'll take my finger out, do some more hand hygiene, and I'll put new gloves on. If I didn't say it earlier, I do like to put gloves on during all my patient care assessments just because I want to keep the patient safe. So I do always wear gloves. So I put new gloves on, even though baby is bathed and she's a day old, she's bathed and clean. I'll put those on anyways. And then also, I didn't mention earlier with my skin assessment, baby does not have any vernix going on, no chunky white cheese or anything going on her skin since she was bathed already. And then I don't see any little tough hairs anywhere. Baby's lanugo, there's not much lanugo. There's a little bit on the belly, but I don't see much. So her skin looks great. I don't see any unusual skin conditions. I don't see any rashes or bruising or anything. On the face, I also don't see bruising or scratching or anything like that, but that can happen during the birthing process just because sometimes it can be something, but I don't see any scratching or bruising on this particular baby. Yeah, just no signs of rash or skin conditions or anything like that. Baby's skin looks great. No scratching, bruising, like I said earlier. So then I can go ahead and go on down. I did a clavicle, did my umbilical. I could go ahead and move down to baby's genitalia. I'm going to do baby's legs, arms, and reflexes in a second. I'll go ahead and do genitalia. This baby is a female. I'll assess her labia. She's a term baby. Her labia is covering the clitoris. I can assess for any drainage, discharge, anything like that. If baby was having some bleeding, that would be normal from the vagina since the hormone boost and stuff during birthing, pregnancy, all of that. I don't see any of that though. Her diaper is also not soiled. I could question mom and ask mom when baby last urinated, when baby last had a bowel movement. I could do both of those just to make sure baby is voiding properly. And this would also be a good time to ask mom about baby's feeding habits. Ask mom about how often baby's feeding, if baby is eating, if she's doing breast milk, if she's doing formula, how often, how much, just to assess baby's dietary and all of that. And also, if this baby was a male, I would also do a genitalia assessment. I would look at the penis. I could do that first. Look at the urethral meatus. Just make sure it's centered midline. It's not to the side or anything. We want it centered midline. I could also assess and see if the baby was circumcised. I would note foreskin or absence of foreskin. And then I could also do the scrotum assessment. I want to see if the testes are descended. I'll do one at a time. So I'll hold down and I'll feel one testy at a time for the male assessment. So I finished my female. If diaper was soiled, I could just change it for mom. And then following that, I can go up and go ahead and do, while I was uncovered, if I didn't say it already, the jaundice assessment, my forehead, my eyes, chest, abdomen, thigh, turgor. I did that earlier. Okay, and then I can go ahead and do baby's arm recoil. I'll do her legs next. Put her arms up. Arms should recoil and go back down. Baby should keep moving. If one was flaccid, that could be, a sign of a clavicle break, but baby's arms are both good. And while I'm doing this on baby, I could go ahead and look at the palms, look at the creases. Baby's term, so she should have more creasing. Creasing is great for baby's age. I'll count the digits. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Baby's digits are normal on both hands. Baby's legs, I'll go ahead and lift the legs up. I'll do the Babinski while I'm here and count digits. I'll set my finger up the ball of the foot where I can do it across. Baby's toes should fan out. And then 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Baby's toes are good on both sides. She has all her toes. And I'll go ahead and do range of motion. Her legs are really good at range of motion. All right, if I didn't say it earlier, baby's good range of motion everywhere because she's just squirming all around. So I'll do the baby's feet and her little fingers, her palms. Next, I could go ahead and flip baby upside down and assess the spine. So I would hold baby, flip baby upside down, pull up baby's shirt. In real life, I wouldn't hold her like this, but for my assessment, I'll look at the spine, make sure the contour is good, make sure it's midline. It's not, there's no unusual things going on. I want to check and make sure there's no bumps or anything at the spine, any dimples or any tufts of hair that could lead to signs of spina bifida. The baby's spine is looking great, midline. I don't see any dimples, tufts, anything like that going on at the base of the spine. Baby's spinal contour is great and baby's spine looks good. No signs of abnormality anywhere so far. Okay, so I'll flip baby upside down. I'll put baby down. And I'll go ahead and do my little Moro reflex. Baby should go back like this with 2 C's. That'll throw the baby. So I'll go ahead and do that. I finished my little reflex. The baby is good. And then I'll just finish up, ask mom more questions about voiding, feeding like I did earlier. Ask mom how baby is doing, if baby is behaving normally like she should. Ask mom if she wants anything else, if she wants any help with baby, and that would conclude my assessment. I'll swaddle baby back up and make sure baby gets warm. All right, little one, I'll see you later.